on. Today I'm presenting dementia, and the two other wonderful people in my group are Maddie and Emily, and Emily's not here right now. Alright, so what is dementia? The term dementia is caused by a wide range of conditions, including Alzheimer's disease. Dementia affects the memory, thinking, and social abilities severely enough to interfere with daily living. As seen in the picture up here, dementia is a term used to describe a range of symptoms associated with cognitive impairments. In other words, Alzheimer's, vascular conditions, Lewy body dementia, and frontotemporal disorders can also account for dementia. So moving on to symptoms, there are two types of symptoms. There's the cognitive symptoms and the psychological symptoms. Cognitive symptoms include memory loss, confusion and disorientation, difficulty communicating, difficulty reasoning, and difficulty handling complex tasks. These are usually influenced by the effect that dementia has on the brain. And then there's psychological changes, which are personality traits, depression, anxiety, inappropriate behavior, and paranoia. So moving on to assessments, one of the most important assessment tools for a patient with dementia is obtaining a detailed patient history. Patient history includes identifying family members with dementia or other cognitive disorders, recording a detailed medical history of the patient, including nutritional and activity status, hygiene status, which usually means like bathing, being able to brush your teeth, and normal ADLs. As nurses, we complete assessments all the time, which is kind of our part in it. And for assessments, assessments involve lots of observation. Is the patient forgetful? Does the patient struggle to determine or to remember the correct wording for things, or to formulate sentences? And do they become easily agitated is another key factor. What are the causes of dementia? There are two most common types, but they don't really know all of the factors that cause dementia. But two of the most common ones that they see are vascular and protein buildup. Vascular is when there is a limited blood flow going up to the brain, usually caused by years of smoking or having a stroke. And then protein buildup. Protein buildup disrupts cell function, and after being smothered by protein buildup for a while, the cells start to die off, and thus the brain starts to shrink in portions and areas. So diagnosis. Unfortunately, there are no specific ways to diagnose dementia. For example, there's no specific tests that a doctor can perform to ultimately diagnose someone with dementia. However, after studying a list of factors, as seen on the slide, doctors are able to be fairly positive when someone has dementia. These factors also include medical history, performing a physical exam, lab tests, and specific changes such as behavior and functions, as well as types of dementia. Types of dementia are difficult to diagnose because you can have multiple dementias. And usually the only way to pinpoint what kind of dementia a person has is to do an autopsy after death to see what parts of the brain dementia has affected. So treatment. There is no cure for dementia at the moment. We only have found ways to prevent or delay the effects of dementia. To lessen your chances of dementia, you can avoid drugs, alcohol, and smoking. To live a healthy life, especially getting heart healthy. Treating any current mental illnesses and avoiding head injuries. And to delay the effects of dementia, there are two different types of medications you can try, which both help to break down the harmful proteins that build up in the brain. The other option is cognitive stimulation therapy, which helps cause your brain to engage more in what you're doing and makes it focus more to prevent distraction. Prognosis and follow-up. Dementia does not have a cure, but is a progressive disease. It gets worse and worse over time, and ADLs get harder to perform. It is because of this progression that prognosis of dementia is very not a very positive one. Because it progresses in different rates in different people, the follow-up for dementia depends on the person's condition. Often, many times, patients end up in the hospital or in a nursing home for an extended period of time or until they die. Treatments and support are the best medications to give to your person with dementia.